Hi, I'm Dr. Bagen at Florida Orthopaedic Institute, and today we're going to be talking about a common cause of heel pain, and that cause is going to be plantar fasciitis. So the plantar fascia is a band of connective tissue that runs along the bottom of the foot. It connects here at the heel and kind of fans out towards the toes. And with plantar fasciitis, you actually get some breakdown of that tissue, that connective tissue, and that is what causes that pain that you experience with plantar fasciitis, is the breakdown of that tissue, degeneration of that tissue. So a couple things that patients will complain about when they have plantar fasciitis is that they have the most pain in the morning. Some of the first steps that they take when they wake up, that's when the pain is really the worst. Throughout the day, it can get better, but sometimes that pain just never goes away. But that's one of the key things that we look for when it comes to plantar fasciitis. The cause of plantar fasciitis is not entirely known, so we know that it has to do with breakdown of the tissue, and that can be from overuse, but there's not a clear-cut cause as to what starts all of this degeneration to begin with. A lot of times plantar fasciitis is a diagnosis of exclusion, so we can rule out other causes of heel pain, and this is something we can diagnose on ultrasound. About 80% of patients with plantar fasciitis will get better in 1 year. So that's the good news. That's without treatment. That's with, just letting things go as it will. So if you wanted to speed up that process, which most people do, we want to try some conservative treatments first, and that usually does speed up the healing process. So as far as conservative treatments, we can rest, we can ice the area that's causing the pain. A lot of times we will use an orthotic where we're creating a heel cup to give some padding to the heel in the shoe. Some people have issues with more of a flat foot, so they lose some of that arch support. That can also help as an insert for arch support as well, can help the heel pain. Other things that we will try are splints, so night splints to keep the foot in a more neutral position at night while you sleep. There's physical therapy where they're really going to focus on the mechanics. So improper mechanics as you're walking or as you're running can cause plantar fasciitis. So that's a way to correct certain things. If you overpronate, if you pronate as you walk or run, that's something that can be addressed in physical therapy. Other things that we can try, with runners especially, you want to make sure you have proper footwear. So with that, if you are a runner, you want to replace your shoes, your tennis shoes, about every 300 to 500 miles. So, making sure you have good supportive footwear, and yeah, a lot of these conservative treatments, are things that you can be aware of. You can try at home. If it gets to the point where you need something a little bit more invasive, we can actually do a steroid injection. We can also do Prp injections, which use your own platelets. And if all else fails, then there are surgical options as well. But as long as you've tried all the conservative treatments, you've given it enough time to heal on its own, if that's going to happen, which luckily for 80% of patients it will. But if not, there are those surgical options. So so I hope that helps. If you're experiencing any heel pain, could be due to plantar fasciitis. And if you have any questions, you can reach out to us and we'd be happy to help.